Well, as far as the mechanical procedures that we have going out there today, cardiovascular medicine is riding a wave on stents and on bypasses. And they're extremely expensive, and they can be quite dangerous. I mean, you can die getting a stent. You can die getting bypassed. That doesn't happen if you're eating whole food, plant-based nutrition. And there's no question, though, that I think we have to give due credit to the fact that when somebody is in the middle of having a heart attack, that an emergency stent or emergency bypass can be absolutely life-saving. Well, what about the other huge percentage of patients who are getting these procedures electively? The data aren't there. There does not appear to be any prolongation of life or any protection from a future heart attack with these procedures. And the reason is, especially what's understandable with stents, we now know that most of the heart attacks occur when a plaque ruptures. A plaque in the coronary artery, the cap over the plaque, becomes so eroded and so thin that it ruptures. So that now you have the extravasation, or the oozing out of, if you will, of plaque content into the flowing blood. And that's going to activate platelets, which are our clotting factor. So as the clotting factors are initiated, right after that plaque is ruptured, you begin to get a clot forming. And as that clot is in and of itself self-propagating, in a matter of further minutes, the clot now goes all the way across the artery, totally immediately blocks all the flow downstream, so that all the downstream heart muscle is now suddenly deprived of oxygen and nutrients, and that's how your heart attacks occur. Now, therefore, most people would agree that the plaques that are most vulnerable for this rupture are somewhat of the size of 5% blocking, 10%, 15, 20, 30, 40, 50. Those are never the plaques that get stented. The ones that are stented have to be almost legally over 75% blocking. And most of these will be 80, 85, 90%. These are not the ones that are at risk for rupture. So, in essence, when cardiology treats these patients with a 90 or 95% blockage, and they'll declare to the patient, "You're so lucky you came, you are a walking time bomb." Well, that's not really the truth, because the 90 or 95% block is not the one. That's going to cause angina and pain, but it's not the one that is most likely to cause a heart attack. And studies careful studies will clearly bear that out. And increasingly, there is data that even some of the medical or the symptoms of angina and chest pain are not that radically at all improved compared to as if you were using drugs and medication and lifestyle change alone. And so it's very interesting how I think once we can really get cardiology educated to this, and they begin to really treat the causation of the illness, you will see fewer and fewer and fewer and fewer of these invasive procedures being utilized, because in addition to each one have the potential of mortality, I mean, you have 3% mortality with open heart surgery. Well, that means if you do 1,000 patients, that 30 people who are dead. You know, that's not something we can be necessarily proud of. Well, the interesting thing was that if you look carefully, they were not following. Our fat in our diet it is not meant to be a no-fat diet, but it's around 11%. Because when you eliminate the oils and the meat and the dairy, that's most of the fat. While there's plenty of fat to be healthy in our diet, it's down around 11%. The women that you're talking about in that study were up around, I think there was close to something like 29% fat. And the high-fat American diet is 34% fat. So the study was flawed and worthless. There are multiple problems how the typical Western diet injures. It injures by causing obesity. It injures by causing inflammation. It injures by causing diabetes. And then it injures by injuring the innermost lining of the artery, the endothelium, and its ability to make nitric oxide. Because when we start out as kids, and our nitric oxide level is way up here, and then right through childhood, teenage years, we keep eating this Western food that's punishing and injuring our endothelial cells, then our production of nitric oxide goes lower and lower and lower. And until now, as you've injured the endothelium, you have these cracks and fissures and opening in the endothelium. Now your bad LDL cholesterol can slip through into the subendothelial space, where it then gets oxidized to this small, hard, dense LDL cholesterol, which now creates this sort of cascade of oxidative inflammation as it gets gobbled up by these macrophages that come in to get rid of it. And then we have this entire cascade of formation of oxidative inflammation and foam cells and all the metalloproteinase enzymes that the foam cell makes that makes this disease even worse, like stromelicin, elastase, collagenase, myeloperoxidase. And so the Western diet really does a job on us. And the body is so remarkable that many people are able to put up with this until they're in the mid or late 40s. And then they are obese, then they've got hypertension, then they've got diabetes, then they've got heart disease, which is what? The end cascade of this absolutely tragic diet we're eating. And we're so misguided by all of the ridiculous advertising you see. I mean, have you ever watched television for a sporting event where you haven't seen something like a Big Mac cheeseburger with dripping up? I mean, that just is there's a heart attack on the screen waiting to happen.